I'm Dr. Massoudi with Aluna Vein Centers, and I'd like to talk to you about varicose vein, venous insufficiency, and how to treat venous insufficiency. Veins are responsible for returning the blood from the extremities back to the heart. Deep veins, superficial veins, and perforators. Deep veins carry 90% of all blood return, run deep in the leg next to the muscles. Superficial veins carry remaining 10% of the blood and run closer to the skin. Venous insufficiency signs and symptoms: varicose veins, spider veins, reticular veins, pain, discoloration, restlessness, heaviness, swelling, burning, dryness, ulcer, or itching. Perforator veins, connected deep and superficial veins, can cause significant complications when malfunctioning. This condition is known as superficial venous reflux disease. Risk factors are genetics, gender, obesity, age, pregnancy, trauma, prolonged periods of standing or sitting. Healthy veins, valves prevent blood from flowing backward. In diseased veins, valves do not close properly and allow blood to pool in the extremity. This is known as reflux. Varicose veins are veins that have become enlarged and twisted due to reflux. These are often referred to as tortuous varicosity or tortuous veins. Treatment for varicose vein is usually covered by insurance when symptomatic. Medically significant symptoms include pain, heaviness, superficial blood clot, skin changes, leg swelling, and skin ulceration. Insurance companies will often require that conservative measures were used before they will authorize treatment. Prescription strength compression stocking for up to 6 months, leg elevation, mild pain medication. Once these measures have been taken, we will request insurance authorization for treatment plan. Endovenous thermal ablation or endovenous laser treatment. EVLT procedure is 30 minutes procedure. Leg is prepped and draped. A small needle is inserted. Wire is threaded through the needle. A catheter is then advanced over the wire to accommodate the laser fiber or radiofrequency catheter. Numbing medication is injected, protects the surrounding normal tissue, minimizes discomfort during the procedure. The ablation device is turned on and the catheter is pulled back. Heat from the ablation device thermally injures the lining of the vein and the vein closes permanently. Post-procedure. Steroid strips, keep clean and dry for at least 5 days following the procedure, will fall off on their own. Prescription strength compression stocking, keep on for 48 hours following the procedure. After 48 hours, take it off at night but wear during the day for an additional 7 days. Resume most daily activities immediately. 1 week and 1 month follow-up visit to assess no complications and to see the treatment efficacy and see if there's need of further treatment. Pain control, we can give Tylenol or ibuprofen, or for severe pain we can prescribe a stronger pain medication. The risks for EVLT: infection minimized by a strict sterile technique, bleeding maximum 1 to 3 milliliters. Skin numbness doesn't interfere with activity and usually goes away in 3 to 6 months. Deep vein thrombosis. Deep vein thrombosis or DVT, the risk is less than 1% chance. Risk is higher with history of DVT, clotting disorders, family history of DVT, or certain medications like birth control pills. We take extensive measures to prevent DVT. Detailed vein questionnaire specific to vein disease gives us a complete history of our patients. Complete ultrasound to map and rule out DVT before procedure. Use of ultrasound during and after procedure. Blood thinners can be given if necessary for patients with high risk, and I have modified standard protocol to further decrease the chance of DVT and to provide the safest care possible. Sclerotherapy is another procedure performed for treatment of varicose veins. The injection of a medication into the vein in order to shut it down. Foam sclerotherapy or liquid sclerotherapy. Foam sclerotherapy performed on veins that are large and deeper to the skin and not visible to the naked eye. Performed on veins that are too tortuous, make frequent twists and turns to accept a catheter, and is performed as an in-office procedure using an ultrasound or vein light for guidance. Medication in the form of foam increases its potency. How foam sclerotherapy works? A small needle is inserted into the problematic vein. Once inside the vein, the sclerosing medication is injected. There are two different medications, polidocanol or sotradecol, which is FDA approved. Once the medication is injected, it fills the space inside the vein, causing irritation and scarring of the vein wall, which ultimately results in vein closure. Cosmetic sclerotherapy is also performed on the smaller spider veins of the legs. This procedure is performed by the doctors and the PAs in the office. This is typically cosmetic and not covered by the insurance. Post-procedure care for sclerotherapy. You must wear a prescription strength compression stocking night and day for 3 weeks following the procedure. 2 weeks following treatment, a follow-up ultrasound makes sure there are no complications and to assess efficacy. There will also be another follow-up appointment after 1 month, but feel free to come in for a follow-up whenever necessary. Risks for sclerotherapy: infection, minimized by a strict sterile technique. Bleeding, persistent bleeding can be controlled with 5 minutes of moderate pressure. Skin discoloration, hard lumpiness under the skin, which is often a result of the vein itself becoming scar tissue. This can be corrected by draining the leftover blood from the vein during a follow-up visit about 2 weeks following treatment. Skin ulceration, this is a rare condition where the tissue outside the vein reacts to the sclerosing agent. Ambulatory microphlebectomy. Ambulatory refers to outpatient care, micro refers to small incision and minimal scarring, and phlebectomy refers to the removal of large, tortuous or bulging veins. Using a special light or ultrasound, the vein is mapped out with a marker. Local anesthetic is used and 2 to 3 millimeter incisions are made along the leg of diseased veins. A hook-like instrument is then used to simply remove the veins. A steri-strip dressing will be applied as well as compression stocking and ace bandages. After steri-strips fall off on their own, keep the incision site dry and clean for at least 5 days. There will be some bruising and pain for about 1 or 2 weeks following the procedure. Tylenol or ibuprofen and arnica can be used for pain, and 1 month follow-up visit will be scheduled for you. The pros and cons of phlebectomy versus sclerotherapy. The pros: there is no discoloration when we do phlebectomy, but the cons are may need more than one treatment or procedure to get all of the vein. Also might need sclerotherapy to close smaller and deeper veins. The pros for sclerotherapy gets the whole vein, but the cons is more likely for discoloration to occur, possible trapped bloods.